Hello, this is Dr. Sanjay Pisharodi on behalf of Purnarogya Holistic Healthcare. We are continuing our discussion on Kasa, Ayurvedic diagnosis and treatment of cough from last time. I would like to welcome each and every one of you cordially from the core of my heart for joining me today. So just to give you a preview of what we discussed last time, since this is the part 2 of the discussion. Last time we discussed about a patient. We just started with that. We discussed about a patient who was 55-year-old female with a history of cough for about 2 to 3 months. And I would like to just share this with you. So the patient was having cough since 2 to 3 months. She took some Ayurvedic treatments. Initially, the cough was a dry cough, and she had taken some treatments, Dashamula Rasayanam, and there was some relief, but eventually over a period of time, the cough relapsed, and this time it came back with more severity. She had a little fever. She had some sputum coming in, mucus. It was not so yellow, but it was more whitish in character. And she also had a habit of going for long walks, and she has a history of pain in the heels, and she has had a history of rheumatoid arthritis in the young age. So this is the history. She lives in South India, which is a more humid, hot and humid atmosphere. Diet is, she's a diabetic, and her diet is quite simple, grains and a few vegetables. She's a vegetarian. So in this background, we discussed about how to make a diagnosis, how to make an Ayurvedic diagnosis. We discussed about Dashavidha Pariksha, the tenfold examination, as well as the Ashtasthana Pariksha. The Dashavidha Pariksha, as you all know, we have the 10 different systems: Dushyam, Desham, Balam, Kalam, Analam, Prakritim, Vaya, Sattvam, Satmyam, Tatha Aharam, Avastha cha Pritham. So the different explanations, the different assessments, the dosha status, the dhatu status, shrotas, mala, and so on. Desha, the location of the person, where they live, the location of the disease in the body. Balam, the strength or immunity of the strength of the body, the strength of the body to withstand any disease or imbalance. Then Kalam, which is season, time of the day, season. Then the age of the patient can also be included in time, although it's coming later. And also the time of onset of disease, how long has the disease been there? Analam, the digestive fire, what is the digestive ability? Does the patient have a good appetite? What is the tolerance of hunger? And so on. Prakriti is the constitution of the patient, the individual body constitution. Vaya is the age of the patient. Sattvam, Satmyam. Sattvam is the mental strength, psychological assessment, how, because many diseases do have a psychological component. So there has to be a psychological assessment. Satmya refers to habits. For example, in this patient, she has a habit of walking about 4 to 5 kilometers every day. And other kinds of habit, for example, she has a habit of speaking very loudly, speaking very often. Atyucha bhashanai. We will see that later. So habits, satmyam. Tata aharam, what kind of food, whether she takes dry food or oily food, hot food, cold food, what is the time of taking the food? So all these things. and does she take the food fast, or does she eat fast or slow? These things have to be assessed in ahara. And finally, avastha, what is the stage of the disease? So this is Dashavidha Pariksha. And then you have the Ashtasthana Pariksha, the eightfold examination, where we see the pulse, the nadi, which is called as the pulse. And we have the assessment of mala, feces, stools, mm, their texture, the color, quantity, timings, and so on. Mutra, urine, the frequency of urine, the amount of urine in 24 hours, any change in color, status, so on. And then there is the akriti, the shape of the body, whether the person is obese, or is the person lanky, thin, or medium build, and so on. And then there is also the assessment of four different sense organs, except for the nose, all the others. The tongue, inspection of the tongue, any coating, any change of taste, and so on. Jivva, inspection of the eyes, color of the eyes, vision, and so on. Then inspection of the skin, any change in the complexion, any change in sensation, temperature, cold, hot, and so on. The sensitivity of the skin. Then also the ears, any sensitivity to sound, any ringing sensation, pain, so on. So these are the different assessments in the tenfold and eightfold examinations. So we did that last time, and we found out that the predominant dosha which is involved in this patient is vata dosha. Initially started with vata dosha, and then now there is also an involvement of kapha, and a little bit involvement of pitta is there. So we looked at all the different symptoms of vata aggravation, pitta aggravation, kapha aggravation, and we enumerated all the signs. How do we judge whether there is a vata aggravation or pitta aggravation? For example, she complained of a lot of body aches, so that is a sign of vata aggravation. Sramsa vyasa vitaswapa sadhuruktoda bhedanam. Different types of body aches mentioned in the chapter 12 of the Ashtanga Hridayam signify a vata aggravation. Increase of body temperature, and vata rakta, this pain in the heels, then the history of rheumatoid arthritis and other inflammatory changes in the body suggestive of pitta vitiation, and kapha vitiation, where she had a loss of appetite, and she had mucus coming out. So we will see that also as we go ahead. We saw the general signs of the aggravation of the doshas from chapter 11 and chapter 12 of Ashtanga Hridayam. And then we looked at the dhatu involvement. Dhatu involvement, we saw the signs of kapha, or sorry, the signs of rasa dhatu involvement is mainly fever, initiation of the rasa dhatu, and also the other signs of kapha, rasopi shleshmavat. Shleshma means kapha, and rasa dhatu is the vitiation of rasa dhatu has the same symptoms as that of kapha. So we saw that there will be loss of appetite, and there will be a heaviness in the body. Let's see. So we saw the symptoms of kapha vitiation from chapter 11. Chapter 11, doshadi vitnyaniyam, it is called in Ashtanga Hridayam. So श्लेष्माग्नि सदन प्रसेकालस्य गौरवम वैत्य शैत्य श्लथांगत्वम श्वास kasa atinidrata. So this shwasa and kasa is specifically mentioned about the kapha aggravation, that there will be cough. So because cough is especially coming from the kapha sthana, it is a disease of the kapha sthana of the body, as we know that the upper part of the body is more kapha predominant, the middle is pitta predominant, and the lower part of the body below the navel is a vata predominant area. So kasa and atinidrata, sleeping too much, feeling too lethargic, and feeling sleepy during the day, no appetite. So these are all the symptoms of rasa vitiation as well: rasa aggravation, rasa disturbance, distortion. Now the next was Rakta. We also saw that she had symptoms of Rakta vitiation. She had reddish or yellowish discoloration of the eyes and slightly feverish sensation now and then, little slight yellowish discoloration of the sputum. And we said about the Rakta Visarpa Pliha Vidrati Kushta Vatasra Pittasra Gulma Upakusha Kamala. This is in the verse number 8 and 9 of the Ashtanga Hridayam, chapter 11, Sutrasthana. So we established that yes, she had definitely some involvement of the Rakta. And then there was the involvement of Mamsa Dhatu as well. Mamsam Gandar Buddha Granthi Gando Udara Vridhita. So she has a kind of a laxity and looseness of the body, and she is not able to really move about very easily. So this Mamsa Dhatu vitiation is also there to some extent, because there is also pain in the muscles because of repeated coughing. There is involvement of the chest muscles, and there is some pain involved there. So we saw that these are the dhatus involved. Mala, there is excessive accumulation of mucus, and she has already undergone, and so these malas are involved. She also has excessive sweating, which indicates rakta involvement. The sweda is also coming out more, especially in the night time. So that also indicates a pitta involvement. So in this way, we analyzed the Dashavidha and the Ashtavida. And the last time, we actually stopped at a point where we were actually analyzing the different sub-doshas. We were trying to see which are the sub-doshas involved. And according to the Sushruta Samhita, Sushruta, he says that the sub-doshas that are involved in Kasa are the Pranavata and Udanavata as far as the Vata is concerned, and the Avalambaka Kapha, Avalambaka Kapha, which is involved in the chest region as far as the Kapha is concerned. And there is also the involvement of Samana Agni, the Pachaka Agni, Samana Vata, Samana Agni, which is there in the core, which is a digestive fire, which is also involved in the case of Kasa, and which causes and therefore loss of appetite. So now we move into today's discussion, centered around understanding what is the nidana of cough. Nidana Panchakam. We know that the understanding, the complete understanding of disease in Ayurveda is known as Nidana Panchakam, which involves the 5 factors which tell us everything about what a disease is all about. Nidana Panchakam is described in the Ashtanga Hridaya Nidana Sthana, chapter 1. It involves 5 different factors. The first one is Nidana, the second is Purva Rupa, third is Rupa, fourth is Upashaya, and the fifth is Samprapti. What are they? Nidana basically means cause, any cause that leads to a dosha vitiation. There can be no disease, as it is explained in the Sutra Sthana. There can be no disease without the disturbance or vitiation or distortion of the doshas. Yatha pakshi paripatan, just as the shadow of a bird flying in the sky follows the bird, similarly the disturbance of the doshas, they follow the disease. Without dosha disturbance, there cannot be any disease. So what are the causes? We looked at the general causes of disturbance of the doshas, and we can look at the person's lifestyle and try to understand whether this person is doing anything which is actually causing disturbance of the doshas, and which causes a little extra aggravation of the dosha. And especially when one indulges in these activities during a season also which is favorable for the aggravation of the, it can actually tip the balance, and also the diet, and can result in the formation of this disease. For example, in this patient, we see that vata vitiation is brought about by a long walking. Long walk. Roga Nidana, the first chapter of the Ashtanga Hridayam, gives the different causes of vitiation for each of the doshas, for the aggravation of the doshas. And one of the causes for vata aggravation is described as adhva. Adhva means walking long distances. So this person, as we know, is walking for about 4 to 5 kilometers every day. and she's also in elderly age, which is a Vata age, which is also part of the pathology, which can a factor which can actually influence the aggravation of Vata. She also talks very loudly. Atyucha bhashanai. Atyucha bhashanai means speaking very loudly and speaking for a long time, continuously speaking. Ati bhashanai and ucha bhashanai. Ati is excessive, so ucha is loud. So she has a habit of talking loudly, talking for a long time. So these are the things that we need to advise her. So please maintain some mauna vrata. Is very good advice for such a patient, such a client, to ask them to remain, to observe complete silence for at least 2 or 3 days. that's uh, that's an austerity. That's something which is very difficult for them, but that's going to be very beneficial. So in this way, the nidana, so in the food, whether she's taking any kind of dry foods or any kind of fermented foods, so these are the things which need to be seen for any kind of vata vitiation, whether it is happening. Any heavy foods which she is not able to digest well. So vata vitiation, kapha vitiation, pitta vitiation, we saw the different causes in the first chapter of Ashtanga Hridaya Nidana Sthana. And then we are going ahead to look at the nidana, the five nidanas, the five nidana panchakam, the factors which tell us everything about kasa. So these are the different nidanas of kasa, which causes vata vitiation, ruksha, pramita bhojane, sleeping at irregular times, staying awake for long time in the night, and irregular eating times, no discipline in life. These are the things, excessive workload, stress, and the ruksha, eating dry kind of food, not drinking enough water, not having enough moisture in the body, and also constipation, to not being able to empty the bowels properly. So these are the different things which actually cause kasa, which initiate the process of kasa, because vata is the dosha which is the initiation of kasa. And then we saw about now as we go ahead, let me just pull up this slide for you. We have a PowerPoint slide here which I want to share with you guys. What is nidana panchakam? Nidanam purva rupani upashayas tatha sampraptis cheti vijnanam roganam panchadha smritam. You guys already know about this. Nidanam purva rupa upashaya and samprapti. What are they? I'll just explain very briefly. Nidanam is the etiology, the cause of disease. Purva rupa is a premonitory symptoms. That means that which comes before the rupa. Rupa is the actual sign and symptom of a specific disease. So rupa is the particular sign and symptom that actually tells us about that we can actually pin down a diagnosis, whether it is kasa or shwasa or rajakshma or rakta pitta or vata rakta, whatever it may be. There are specific symptoms for these different diagnoses, and they are known as rupa. But before the rupa actually comes about, you can have premonitory symptoms which are like non-specific. They do not actually belong to a specific disease. They are like a general symptoms which do not exactly point towards a specific dosha or a specific dhatu, but they actually give a sign of impending disease. So purva rupa, that which comes before rupa, called as premonitory signs, which can be just uneasiness, lack of appetite, and just feel some disturbance in the sleep, and general disturbances, you can say, are coming in the category of purva rupa, which later then, if not properly dealt with, can actually manifest into full-blown disease and signs and symptoms, which is known as rupa. Once the symptoms are more marked and clear and distinct, then one can actually try to diagnose them. But even in those cases, sometimes there could be some confusion. To avoid this confusion and to come to a proper diagnosis, we can use the fourth tool, which is upashaya. Upashaya is a method that we can use by introducing either diet, lifestyle, or different medications, herbs, to either which can either aggravate the disease or which can pacify the disease. So if the upashaya that we choose, the method, the trial, it's like a trial of some substance intervention. If we decide to if we decide a certain thing, for example, we may say, okay, you can start drinking some hot water or some ginger water, for example, and we observe the person for some time. If the upashaya that we have chosen is going to aggravate the disease, or let us say pacify the disease, then that's a positive trial. And if it's going to aggravate the disease, that's a negative trial. And the negative trial is called in Ayurveda as anupashaya, upashaya and anupashaya. So if the symptoms are pacified, it is upashaya. If the symptoms are aggravated, it is anupashaya. And upashaya can be either ahara or vihara or aushadha. So these are the three different aspects of upashaya. There are 18 different types in which we can administer upashaya. So we will not get into that now. Uh, the last and final thing is the samprapti. Samprapti is the full story actually. Prapti means to get something, and samprapti means the complete story, the complete the the entire etiopathogenesis from the beginning to the end, the the whole the whole story of how, from the nidana, from the initial cause, from the first day, how and what the patient did and what happened, the next step, and step by step narration of how we reached the present condition. So this is called as samprapti, which tells us everything about the disease. It's a summarization of nidana, purvarupa, rupa, upashaya, and so on. So these five factors actually tell us everything that we need to know about the disease, so that we can actually get into the point of actually deciding where we need to intervene. In fact, Ayurvedic treatment is nothing but samprapti vighatanam. To actually break the samprapti, to intervene in the samprapti, to actually stop the progression. And and this can be done at various points in the disease. Once we identify the cascade of how the different pathological processes have happened, so we can actually intervene at different multiple positions, multiple stages in the samprapti, to give an effective cure to the disease condition. And what is the cause for disease? And when we talk about nidana, we said that nidana is the cause. Fundamentally, if we ask what is the cause of disease in Ayurveda, just to touch upon that, in the Sutrasthana, it is explained, Arthe rasatme samyoga kala karma cha dushkritam hinati mithya yogena bhidyate tat punastridha. Sorry. So ahara asatme, one thing is food. Ahara, food basically in Ayurveda means food for all the five senses. So that's not just the mouth, it's the eyes, ears, nose, mouth, and the skin, and the ears as well, the nose. So all the five senses have their own food. And asatmya means some incompatibility in terms of the senses and the sense objects. The sense objects are the food for the senses, and this is one of the causes for disease. And the second one is kala. Kala is time. So timing is the essence of life, as we all know. Timing is the essence of doing everything. So our age, our time of doing things, the choice of time, the seasons, so all these things are part of the kala aspect of the cause of disease. And the third is karma. Karma is where our voluntary activity comes in, where we have a free will. We have a free will. What we want, we can decide what we want to do, what we don't want to do. And depending upon our own intelligence, and depending upon our cravings, or different aspects of different factors, we decide at different circumstances what we want to do. And what sometimes we even know that this is not something good for us, but we still go ahead and do it because we are so much attached to that, we have a craving for that. And that aspect is actually known as karma, where it could be either coming from this life, or it could be coming from a previous life. So these are the three basic fundamental causes of disease, and every factor that can cause a disease will fall under one of these categories. That's the beauty of Ayurveda, that it can actually summarize something which is so huge into just three factors. And there can be three different ways in which these factors can present. One is hina, and the second is ati, and the third is mithya. Hina is deficient, so it could be either deficient or less than normal, and ati is actually excessive or more than normal, and mithya is an improper way in which it is. It's a methodology. For example, you're reading a book and you have less light, you have more light, or you can be reading in a moving vehicle where there is a lot of vibration. The light may be perfect, but still you're not reading in the right way. Or you could be reading standing upside down, or the book is upside held upside down, and so on. So this can put excessive strain on you, and actually can lead to different imbalances. So these are the three different aspects of disease. So we can actually assess in this particular patient what are the different factors which fall in these three categories as well, a way of looking and finding out the nidana, the cause of disease. What is the nidana of this symptom cough? We will look into that as we go ahead. What type of cough? How many types of coughs are there according to Ayurveda? And the next one, depending on we need to categorize. So as we said, the three doshas are responsible for all the different diseases. So we can categorize the general causes of vata vitiation, and even we can even categorize it according to the subdivisions of vata. If we want to be more specific, more pinpointed. So here is the shloka, the verse which explains about the vata vitiation. What are the different general causes for vata vitiation? We already discussed that. Tiktoshana kashayalpa ruksha pramita bhojanai dharano dirana nisha jagaratyucha bhashanai kriyati yoga bhishoka chinta vyayama maithunai grishma hora tribhuktante prakupyati samiranaha. The word samirana actually means vata, and all the others are just different factors that we already discussed. Tikta ushna kashaya, eating too many bitter stuff, eating too many too hot, too spicy, and too astringent, too dry foods. So these are the different things. For example, one eats a lot of salads. Salads are actually bitter in taste. They are also astringent. Ruksha, dry foods, dry nuts and dry bread and stuff like that. Pramita, irregular timings. One of the most important thing that we need to find out is dharana udirana, whether the person has a habit of actually withholding the natural urges. I don't have time to go into the details of natural urges. We can take it up in another class, but suffice to say that you can find the detailed explanation in Ashtanga Hridaya Sutrasthana in chapter 4, where about 13 different natural urges are described. There are more than 13 if you if you want to really say look at it. You can actually find more than that, but at least you can make an analysis of the how what the person's habit is. For example, somebody feels an urge to pass stool, but due to circumstances, occupation or habit or whatever reason, laziness, one may have a tendency to hold it. Somebody is doing something very important and you feel like urinating, going to the bathroom, but we may have a tendency to hold it and wait till we finish our work, something important going on. So this is considered to be very unhealthy, and actually vitiates and disturbs the vata. Nisha jagara, that is staying awake in the night and speaking very loudly, speaking for a long time, just like what I'm doing now. I'm continuously speaking. This actually can aggravate my vata. So I need to do something to balance that, otherwise I can end up with a chronic cough. Kriya ati yoga shoka, kriya ati yoga, just see this. Panchakarma, which is very popular nowadays, is actually described here as one of the causes of disease. If it is not done properly, if it is excessively done, cleansing is very good, but cleansing, if it is done beyond a certain normal limit, can actually be very harmful. So ati yoga of any kriya is a cleansing process, and ati yoga means excessive, and bhi, fear, shoka, grief, chinta, anxiety, vyayama, exercise. Very interesting how people are addicted to exercise. They feel that the more exercise we do, the more healthy we will be. But here we see that it has to be in optimum level. It has to be in a proper time. I have seen people exercising in the middle of the night, midnight. They say this is the only time we have, so therefore let's get some exercise at this time. So these are the different things. Maithuna, sex life should be regulated. Grishma, Hora, the seasons. So summer season is a time when there can be vata accumulation. These are the different causes for pitta vitiation, which can cause a pitta disturbance. Svadvam lalavana snigdha guru abhishyan dishitalai. Asya swapna sukha jirna diva swapnati brahmanai. प्रच्छर्दनादि अयोगेन भुक्तमात्र वसंतयो पूर्वान्ने पूर्वरात्रे श्लेष्मा. Sorry, this is for श्लेष्मा, which is actually kapha. So I have not included the pitta here because we are mainly discussing about the vata disturbance and the kapha disturbance in our patient, in our client. So she has actually many of these, as we discussed earlier. Many of these, we saw that she has many of these different nidana, the different causes for vata and kapha vitiation. Swadu amla. She has craving for sugar. She has diabetes, so it can also be included in swad. Diabetes is actually a kapha disease, so there is a natural tendency for kapha vitiation. Swadu amla lavana, salty foods, sour foods, oily foods. South Indians generally have a tendency to eat a lot of oily food. Guru Abhishanti Shitalai. Abhishanti is actually a food which causes increased secretions in the body. An example is yogurt. Too much yogurt, especially in the night, can cause a lot of secretions, and the secretions can actually lead to kapha vitiation. Shitalai, too cold foods, ice creams, and food from the refrigerator. Some people have a habit of drinking very cold milk and so on. Asya swapna sukha jirna diva. So we discussed all these different factors. These are all given in the first chapter of the Ashtanga Hridaya Nidana Sthana. So I'm not going into the details of that. Vasantayo is very significant because she developed this cough in the springtime, which is now. And spring is a time also where there is kapha aggravation. And she also experiences excessive cough in the night time. So in the early part of the night, she says she experiences a lot of cough, and we can see here Purvaratre. Purvaratre means the first part of the night, which is after the sunset. In the evening time, in the late evening, basically she has a lot of cough and mucus coming out at this time. And this makes sense because this is what Ayurveda is saying, that Purvaratre is Shleshma. Shleshma is kapha. So there can be a kapha aggravation. It is a time for kapha aggravation. The body location is the chest, of course, the Urasthana. Urasthana Udanasya. Urasthana is also the place of the Udana Vata, and Uraha is also the place of Kapha Dosha. So that's very interesting. And the climate is Grishma, as well as just the beginning of the spring season after the winter. So Grishma is summer, and also the spring is Vasanta. So Grishma and Vasanta are both. Grishma is the time for Vata aggravation, and Vasanta is the time for the Kapha aggravation. That's interesting. So we need to keep that in mind. And this is the Vasanta season where she's having mucus forming all over. Now, what is the etiology? How does this Kasa happen? In Sushruta Samhita, an interesting thing is explained that Kasa, Hikka, and Shwasa. Kasa, which is cough, Hikka, which is hiccup, and Shwasa is more an extreme form of breathlessness, which can be like asthma or something like that. Some of the causative factors are mentioned here, the specific causative factors. You can actually categorize them in Vata, Pitta, or Kapha very easily. Here it is said, Dhumopagatat Rajasthaiva. Dhumopaghatat Rajasastathaiva Vyayama Rukshan Nishevanacha Vimargagatvad Bhojanasya Vegavarodhat Kshavatostathaiva. Very, very beautiful verse here. Dhuma actually means smoking, and a lot of smoke, either passive or active smoking. People also in India cook using firewood, so there can be a lot of smoke in the kitchen. Dhuma upaghatat, rajasas tathaiva. Rajas actually the people can be allergic. It indicates the one of the causative factors as an allergic component of pollen dust. Especially the springtime is a major time where this can happen. Vyayama, we already saw that exercise, ruksha, dryness. Vimargagatvad, what happens is the vata actually starts moving in an abnormal direction. And one of the most important is to suppress the natural urges, the vegas. So this can actually result in kasa. This is the nidana or the cause of kasa given in Sushruta Samhita. More causes are mentioned. Vidahi, Guru, Vishtambi. Vidahi is actually very foods that cause burning sensation, which can be very pungent foods, spicy foods, sour foods. We saw all that. This is actually a repetition. In Sushruta Samhita, there is a chapter on Kasa Pratishedha, and the third, fourth, and fifth verse, they actually discuss about Hikka, Shwasa, and Kasa. They all have the same etiology. They're just progressive stages of the same disease. So some people can have very resistant hiccups. It could start in a small hiccup, and then it could, get transformed into kasa, which is cough, and then later into something like asthma, breathlessness, and any kind of disease which leads to severe breathlessness. It could be pneumonia, it could be any kind of blockage, pulmonary embolism, or any of those things. So these are all categorized within Shvasa. If you look into the modern aspect, some systemic causes, they could be the cardiac cause or a renal cause of the disease. The kidneys is actually a vata sthana, a vata organ. So any blockage, for example, as we said, the urinary urge, if we have a blockage, the vata which needs to flow down can actually result in the vimarga gamanan, that is the opposite, in the opposite direction. There will be a pressure in the opposite direction and goes upwards, and it can result in cough. And the cardiac actually is a site of the vata sthana. It is the pranavata, as well as especially the vyanavata is there. Hridistitha, it is the location of the pranavata. If you look at in the 12 Ashtanga Hridayam, if you look at it, the different subdivisions of the vata, Urakanta Charo Buddhi Hridaya, one of the main locations of the pranavata. Ura Kantha Charo Buddhi Hridaya Indriya. The Buddhi is the intellect, Hridaya is the heart, Indriya are the senses, and Chitta is the mind. So these are the different locations where the pranavata is actually functioning. So therefore, a cardiac cause is actually indicating or a disturbance in the vata, resulting in inflammation, constriction, infiltration, compression of the airways. These are the causes which can cause a cough. And I just wanted to complete the list, so I just enumerated all the different endogenous and exogenous causes. The nija and the agantu, as we say in Ayurveda, nija are the endogenous and the agantu are the exogenous causes. It could be some exogenous cause like infection or the seasons from outside, a exposure to a cold breeze, or any of these. And one important thing which we need to notice here is the use of ACE angiotensin-converting enzyme is actually the cause of this kind of a cough. So one has to rule this out. Pulmonary embolism is actually characterized by very sharp pain in the chest. So if somebody, investigations are like X-ray and other investigations can be done, the blood tests to find out system in. In modern medicine also there is a classification like this where they classify it into acute, subacute, and chronic based on the duration. The kala, as we said, among the Dashavida Pariksha, one of the thing is kala, and the duration of the cough can, on the basis of that, we can actually then it can actually be also very chronic. It is different type cough. Okay, so go ahead. I'm getting some kind of network connection difficulty. Is it here? Let me go ahead and see what happens. Okay, let me stop this here.